I am Dr. Shabir Rahman. Today we will discuss about the infectious bronchitis disease in chicken, which is also called IB. It's very dangerous and highly uh, contagious disease caused by the corona gamma type strains. It's not zoonotic. Uh, it's not transmitted to the human. It's enveloped virus, easily killed. In this respiratory signs specialist cause gasping, difficult breathing, coughing, tracheal rales, or heard sneezing, nasal discharge, lacrimal discharge. You see the picture on the left side. These eyes are full of the frothy discharge, and birds are also stretching their head and neck for breathing purpose. It's all due to the infectious bronchitis, blockage of the respiratory tract. In this disease, there is sudden attack of the disease. It is not a slowly coming disease, but it comes suddenly in the flock start mortality, huge amount. In this case, more prone birds are the smaller ages, and the age increases. Large birds are less susceptible to this disease. Incubation period of the virus is 18 to 36 hours. It's very short period. The virus came to the bird's body, and it shows its signs in only in 18 to 36 hours. The morbidity is 100%. All the birds are almost affected. The mortality is 15 to 30% normally. But in case of the nephropathic kidney damaging strains of this virus, they cause high mortality, even to 80%. Four systems affected by the virus. It replicates, the virus replicates the respiratory system mainly. Secondly, in the kidney, renal system. Third, the reproductive tract. And the fourth is the gastrointestinal tract. But more it damages only the first three systems, but not affect the gastrointestinal tract normally. Now we will discuss in detail about these systems, as we have already discussed in detail about the respiratory system signs and symptoms. Now in the reproductive system, you see the signs: misshapen small eggs, rough eggs, shellless soft shell eggs, depigmented pale eggs, egg production drop, and after curing from the disease, the birds never gain the normal peak as he was before, or it should be. It's a permanent damage, permanent loss of production of the eggs. It's a big economic loss. Basically not the mortality, but this production loss is the basic loss. Here you see the soft shell eggs are seen in the picture due to the IB, depigmented eggs, irregular eggs, misshapen eggs, and also the small eggs in case of the IB. This is the basic damage to the reproductive tract, and in the result the ovary is damaged, or all the reproductive tract is damaged. Is abnormal development of the eggs in the body. Here you see the irregular shape eggs and also deposits present on the shell. Now it is a renal system. In this case, you find in the shell wet droppings, high mortality in almost 80%, and birds high water intake starts. And you see in case of the other symptoms, we see there the less weight gain, poor FCR, less feed intake by the birds, lazy birds, dull appearance of the birds, don't like to move from one place to other, even you try to move them. And also the birds rapidly breathe, and to meet up the needs of the oxygen of his body. No vertical transmission in this case, only the horizontal transmission, mostly aerosol transmission by the air, and the nasal secretion and feces found the virus and spread to the other birds. Bird to bird contact, it spreads. The horizontal transmission is very fast, and whole the flock become morbid and so show the signs of the disease. Now you see the postmortem signs. Respiratory signs, you see the trachea is hyperemic, red in color, mucus in the trachea, white or yellowish liquid, white yellowish plug in the bronchioles, congested lungs, thick cloudy air sacs you see when open the body. These all the changes in the respiratory tract create a problem for the bird to breathe. The redness of the trachea due to the suffocation of it becomes red. You see over here, these are the plugs in the bronchioles, trachea. Now here in the middle of the picture you see the white plug in the bronchioles. After cutting the bronchiole you see openly it is the trachea. Redness of the trachea, you see clear redness. The outer side of the trachea becomes red, but it is not hemorrhagic just like the H9. It's only hyperemic. It is the start of the trachea due to difficult breathing. You see the redness of the start of the trachea. These are the congested lungs you are looking here. They are almost dark in color, congested, and even they are going to become infected by the secondary infections of the E. coli mycoplasma. Renal lesions, you see the swollen kidneys. Kidneys become pale and urates deposits in the kidney, and renal damage cause high mortality in the birds. These are the specific strains like Holty. These are the kidneys swollen pale and urates are deposited in it. These strains, nephropathic strains, these are very dangerous for the birds. And you see over here next the reproductive tract, cystic ovaries, misshapen ova inside the body, egg peritonitis, egg break inside the body and spread over there. And it is the damage of the reproductive tract. Ovaries are the basic reproduction unit of the egg, and the shape of the ova changes over here. Calcium is not properly covered in making of the shell. These are, you were saying, the lower, and these are the cystic ovaries, and ovaries are also not so normal. These cystic ovaries can't produce normal and proper normal production of eggs. It is a permanent damage, impossible, almost impossible to recover. Here to see egg is broken inside the body and spread all over the belly, and it is egg peritonitis. Due to this, in the layers, belly become distended, you see, due to the breakage of the heads. Early chick age, when chicks become infected with this virus, and ovaries don't develop properly. So in the future, when it becomes full layer, full hen, it don't produce full production, and in this case maternal antibodies can play their role to save the chicks from this disease. And the vaccination takes time to make it tighter, and once ovaries affected, never it become normal. Infected eggs can't hatch the eggs, and embryo dwarf, curl and die. Prevention is a vaccination of different strains is the only thing to save. First, at the first day, live vaccine, also the killed vaccine of the different strains. One strain don't protect against the other strain, so you should use different strains, and also you should vaccinate with the live vaccine after the 15 days of the first vaccine, live vaccine, and also you should vaccinate hybrid vaccine In one vaccine, there are two different strains called hybrid vaccine. Hybrid vaccine can protect the birds and produce different types of the antibodies to protect the birds from different strains. And this is why the one vaccine cannot protect against the other. Always follow strictly the vaccine rules to obtain its optimal results, and vaccinate in short time. Cold water vaccine stabilizer in the cold timings. In the early in the morning you should vaccine. Use E, selenium and vitamin C before and after the vaccine for getting good results. Don't use antibiotics during or just before or just after the vaccine, but use E, selenium and vitamin C, and vaccine stabilizer should be used for better results. And use good companies for vaccination. Biosecurity measures can stop the virus for to enter the virus at your farm. Regularly spray your farm with the proper good result is infectant like Vircones, Bromocept or any other having good results against all the viruses and bacteria. And clean your farm from the germs by these disinfectant spray. In other management, avoid the very low humidity. Less than the 50% humidity should not be there, and also the more than the 75% humidity is also not suitable. And required optimal temperature according to the age and body weight should be there. Avoid dust in the shed. Avoid rapid weather changes in the shed, especially care during racking, stirring of litter. The temperature and gases may not exceed, so keep ventilation high during the racking or stirring of the litter. And treatment, no antibiotics should be used. These are not effective. Only amoxicillin can be somewhat fruitful. You should use the bronchodilators to ease the breathing. Ventolin, aminophylline, immunity booster like vitamin C, ADEC and E, selenium. Mashed garlic half kg per bag, it's also beneficial. You should use the multivitamins. And Montadine should also be used because there is concurrent infections of the IB and also H9. H9 may be in subclinical, which aggravate the conditions of the IB. And also you should use the Montadine here to avoid co-infection of the H9. A subclinical H9 is present. These are the measures taken in the environment where different germs, high load in the environment, in the near about sheds. You should decide yourself more. After the decline of the mortality by the mentioned treatment, mortality will decrease in the 2 to 3 days. And after that you should use a 4-day course of the tylosine, doxycycline, bromoxine, amantadine and furfunicol to avoid E. coli, CRD and typhoid. H9 germs there are their attack, and E. coli and CRD aggravate the conditions, and almost they come along with the IB attack. They follow the IB attack, then come the E. coli and CRD. Should avoid, they can cause high mortality. No antiviral are present against the IB virus, so don't waste your money. And revise above the course after 10 days in case of the especially the broiler, to avoid the other E. coli, CRD, typhoid infections. And you must use the killed vaccine of the H9 at the day 5 to again its titer. Because it aggravate the condition of the IB. And you should also avoid H9 along with IB, which cause the huge mortality by the vaccination of the H9. Always place good quality chicks so that the IB H9 titers are high in the chicks in the maternally, free of salmonella and typhoid, mycoplasma, E. coli. Chicks should be placed. Keep the water clean. Use clean water free of E. coli. Water lines, water containers should be free of the